to all of you. And I sincerely thank you for taking some time to listen to us and to be ready to, like share your own thought on HIV and AIDS. I was wondering if I should talk about the genesis of the book. I prepared something because we don't actually know some of the names that I will name, but anyhow, the most important thing is to know about the process. For me, it's also a way of passing on my little experience on book editing to other people. That's my first experience, never done it before, so I just want to share with you how I have done it. And I have also some PowerPoint on HIV and AIDS ethics, the population level approach, which is very different from, a condom individual narrow approach to prevention. But that's like, it's mainly about, having a broader vision of prevention at the population level, rooted on a conception of social ethics and social epidemiology, which is an approach to epidemiology. So let's do the genesis of the book, okay? So the book is entitled HIV, AIDS in Africa, Christian Reflection, Public Health and Social Transformation. This is the ancestor of this book, I say the ancestor of this book. The ancestor of this book This is the ancestor of this book. Let's say 3 years ago, we gathered in Nairobi to celebrate the 10th year of the African Jesuit AIDS Network. The African Jesuit AIDS Network is is a network of Jesuit and colleagues working on HIV/AIDS prevention, and AIDS management. A network set up by what we call the president of the Jesuit Conference of Africa and Madagascar. So we gathered in Nairobi, we share our thoughts, we present our paper, and we came up with this book. And in the book, I contributed to this book. In the book, there was a specific, let's say, a presentation that really stood out. Somebody wrote a piece entitled an HIV/AIDS theology, an African HIV/AIDS theology. And I read the piece like once, twice, 3 times, and I began to say, well, this guy wrote a huge piece, in 15 pages, and I began to say, well, this is a book project. Why can't we write this book together? The name of the guy is Wilfredo Cambao. Forget about it. It's somebody who did the work. And he wrote, as I say, a piece entitled African HIV/AIDS Theology towards a holistic approach to HIV issue. He endeavored to sketch out an African HIV/AIDS theology and succeeded quite well in doing so. And the scope of his article went beyond a mere book chapter. Many of the concepts he used needed to be unpacked. Like he had a pastoral approach to AIDS, a moral approach, an ethics of AIDS, a vision of a church that can, truly contribute to the fight against HIV/AIDS. He developed a spiritual theology of AIDS and a theodicy of AIDS, a biblical hermeneutics of AIDS. And I say, well, on 15 pages, that's too small. This is a whole book project. So initially I talked to this friend of mine. He's older than me, but we're very good friends. And I say, why don't we write this book together? You have written the pretext, in French we say le prétexte. Tu as écrit le prétexte. So why don't we write the real text, You wrote the pretext, like the foreword. Why don't we write the book? And he said, well, Jacquino, I don't have much time. If you take the lead, I will follow, And I went on, I talked to other friends of mine, and we begin to see what we can do. And I drafted the concept note of the book, and they kind of critique it. And I took it to some other people. We have a famous Father John Healy, who is a very experienced person who has lived in Nairobi and in Eastern Africa for so many years, and he encouraged me to go ahead with the project. So I move on to set up an advisory committee, a committee of people who have more experience, I mean, I'm a Cameroonian, I'm an African, we believe on the wisdom of the elders, well, it's part of our tradition, is who we are, and we cannot change to become something else, and I will honestly respect other traditions, but this is our own tradition. We have some of these people, some are Africans, other are Americans, like Professor Lisa Cahill. I had her as, one of my professors at Boston College, and some of the big people in the continent, and some of the friends. So to guide me in the process, like you have an idea, you team up with people, and they kind of add on to what you have something else to help you to have a broader vision of what you want to achieve. And after the advisory committee, I set up what I call the editorial committee, people who can read papers, we can have conversation on one article, and each contribution was read at least by 2 people, sometimes even by 3, and sometimes even by 5 people, because we try to save as much as possible, the work of each one of us, because we have some people who have no experience in publishing, and we wanted also to support them so that they can begin to publish. That was also the goal of having an editorial committee, which can actually help people to write. So we came up with a book of 31 chapters, and there's a foreword written by Sean Copeland. I'm really proud of the fact that she accepted to write the foreword of the book. Sean Copeland is professor of systematic theology at Boston College. She's an African-American woman. I was so happy that she did it. The concluding remark was written by Lisa Cahill, who teaches also at BC, and the postscriptum by Jim Keenan was my dissertation director, So you want to do something, you have some of your mommies and your daddies to support you, I have no problem with that. It's not about patronizing me, it's about supporting me, okay? And we came up with a book of 31 chapters, and that has 7 parts, The first part is a socio-historical, cultural, and political context of the pandemic. I designed all the parts of the book, all the chapters, and this is an intuition, a basic and important intuition that came from my training in public health. You want to talk about something? Let's scrutinize the context, the social environment of a given social phenomenon. You want to talk about abortion? Well, sometimes people will judge, abortion is good or bad, but what about the social context of abortion? How does the context shape the risk of, infection? How does it shape the risk of, the ability to manage the disease, the AIDS disease? So we wrote a piece on the first part was on the context of the pandemic and the context of infection. And the second part was about the methodology and normative issues, and the third part was on the Bible, How do we read the Bible in the wounded continent, What is the significance and the authority of the Word of God in the continent hurt by AIDS and many other social issues, And we move on to providing the foundations of an African theology on HIV/AIDS. And then the ethical part of it, and some of the practicalities like worship. What does it mean to pray in the time of AIDS? What does it mean to enter the church or go to the mosque or begin to pray in one's room when I have gotten the news that my aunt is HIV infected? What does it mean to pray God when I know that, a friend of mine is 18 years old and she's infected with AIDS. What does it mean? What type of relationship with God should I have? You know, it seems to be very easy, but it's very challenging. If you read the chapter of this book, written by an American nun who lives in South Africa, what does it mean to accompany people who are HIV/AIDS infected? Spiritual direction with people who are being hurt and wounded by AIDS. This is no joke. You know, this is no joke. It's a deep, serious, existential issue that touches the very heart of what it means to be a human person. Okay? And finally, some pastoral initiative from the Ivory Coast, from Zambia, and Father Ted Roger is a Jesuit. I want to talk about him. Father Ted Roger lived in Zimbabwe. He pioneered the whole, you know, work of the church in Southern Africa on HIV/AIDS. He's a British Jesuit. He's now back home. He's retired. He's 87, you know, and I mean, he's a great guy. You know, he paved the way to so many of us. I mean, yeah. So we have to pay our due to some of our ancestors, you know. Did I jump something? So, okay. So as I do this work, you know, which is, I mean, it's the first time I'm doing it. I have contributed book chapters, you know, but I've never been like the editor of a book. I learned a lot about myself, about me, and about people, you know. The first thing is when you have a project like that, first be a visionary. Set the vision, you know, you need to set the vision. And even, I will call it to set the ideology of the book. And for me here, ideology I take in a very positive sense, you know, like a positive ethics, you know, a set of values that kind of carry a project, you know, in the interview I say this book is an angry book, you know. Angry book is that meaning that we have something to say, which is about the sufferings of people, you know. How do we account for the fact that we're talking about people who are suffering without being moved, you know? You set the ideology of the book, you set the tone of the book, you know. And then respect, you know. At the initial stage of this book, I was a bit pushy. Yeah, I have to confess my own sin, right? Some people drop because of me. You know, I push a little too much, you know. And some people are slow, you know, should we wait, should we continue, you know, which language should I use in such a way that I don't hurt them, but I push some people aside, you know, with respect, you know, patient also, you know. One of the things that I realize is that patience pays, you know, in the sense that some people among us never wrote a book chapter or even an article. You know, in the book, we have 2 PhD students who contributed. That was probably the first venture for them. You know, be patient. Patient in the sense that we have to accompany other people, you know. This is a whole Jesuit tradition, you know. Being a professor, being, you know, an educator is about going step by step with people, you know. Allowing them to grow is about taking people where they are to a different stage. So, patient. And spirit of sacrifice and dedication to the project, you know. I don't remember how many times I slept at 2 a.m. because of this, you know, 2 a.m. You know, if someone doesn't give up something, you know, something great will never come out of what he or she is doing. Yeah? Support those who are still learning. I've talked about it. Be persistent, you know, be persistent. I hunted some of the people, you know. I remember talking to Eluchukwu Ozuku. He's probably the #1 African liturgist. I mean, even in the church, the entire Catholic Church is probably one of the big shots, you know. And I thought, no, Jackie, no, you know, I cannot write. I'm too busy. I'm working on many projects. I came back again and again and again, you know. And so many people, not only Uzochukwu and other people, I try to. Teamwork spirit, working as a team, Elias is here, Professor Elias is here. I honestly appreciate his contribution. I don't know how many essays he reviewed, working together, bring something specific to a given project, a project that opens the way to many other projects, ready for deception, Always have a plan B, even a plan C, I know some people who gave up on us at the very last minute, always have, something in your pocket, and respect deadlines, I will repent here in front of Jim Kim, Jackie, when are you sending the manuscript? I say, man, you don't know how much I'm going through, So some virtues for book editing, and I'm talking to Catherine Gedek, who is a very fine Aquinas scholar, so don't hold it against me. Yeah? So we have some positive reaction. You can read it. You can read and buy the books. The book. So what else? The last point, the theoretical orientation of the book. We did not write this book for ourselves. There's a sort of, I call it the prospective principle that sustained this project. We did not write the book for ourselves. We wrote the book for future generations of Africans. We did not write the book for Europe, for America, for Asia. We wrote it for the next generation of Africans. Why? The pandemic has been with us for more than 30 years, and Africa has suffered a lot more than any other continent. And we say, why don't we gather our thought and share with the next generation how we have struggled, how we have thought about the pandemic, how we have gathered our energy together to fight against, this evil, yeah. So it's about passing on what we know, passing on our own experience, passing on our own dreams to the next generation of Africans in such a way that if tomorrow, like we say in our own traditions, if the daughters of our daughters or the sons of our sons are facing an epidemic, they can start from where from what we have done to invent their own solution to face the problem that they're confronted with. So we have prospective principle. The second point is that in most of the chapter, AIDS appear as a game changer, and I like this wonderful view of Didier Fassin. For those who went to South Africa, Didier Fassin, according to me, has written probably the best book on HIV/AIDS on South Africa. When Bodies Remember. In When Bodies Remember, he considered AIDS as the embodiment of apartheid. Is a biological embodiment of a wounded social system and political system based on racial discrimination. So we consider AIDS here as a game changer, as something calling us to move from where we are to a higher stage. Just like Professor Katongole from Notre Dame said, if AIDS is still persistent in Africa, it means that there's something deeply abnormal, whether with the continent or the global community in which we live. Let's think about it. And finally, AIDS is not something exceptional, it's not, people have treated AIDS. When we look at the early literature on AIDS and we look at the literature today, there's a big change, Initially, AIDS was treated like something exceptional, something that has nothing to do with what is going on in society. As we begin to look at the social condition that produce AIDS, as we begin to look at the type of society where HIV/AIDS is prevalent, we begin to realize that there's a continuum between the way people live and the risk of infection. And the book follows the same line. Thank you.
Very much. No, one question I was going to ask Jackie now, but I actually forgot was how many non-Jesuits were part of this book? I come from a tradition that has actually enjoyed the enormous contribution of Jesuit writing and insight in Africa. And I'm actually very delighted to hear just this little background about all these books because they have become a leading voice, and not only in letting us see how communities of faith around the world have traveled, but the sort of intellectual, spiritual, social categories that have been brought to bear in the lives of people that have enabled them to be able to walk that way. I mean, I still remember vividly during the high noon of liberation theology, we used to joke that you never trust anything on liberation theology except you read it in an Obrist book. And I still actually mean that. They are the ones who brought us people like Juan Luis Segundo and Enrique Dussel Gutierrez and
Sobrino.
exactly, from Sobrino from South Africa, Motlage, and all of the other people who were wonderful articulators of liberation theology. So I'm very delighted that they did this book, and I want to thank Jackie now for taking on this task. I think this is a day for confessions. I still remember when I submitted my piece, I got quite a lot of pushback from all of the readers, and he quietly had to say, look, you're talking to Jesuits and you are at war with the church, and so you need to see from their perspective what they see. And it made me actually rethink the chapter a lot, and I am very thankful for all of that work. Look, this is a long, well-organized text. Since I started reading on HIV/AIDS, it led me to do a book facing a pandemic. At the end of that book, I was very depressed because the crisis continued to mount. The crisis continued to mount. My task in that book was simply to raise the question, what do we say about the image of God that is so battered? It's been 10 years. I think the next thing that I considered a really significant move on the African continent was a workshop that was done in South Africa at the University of KwaZulu-Natal, and the book is titled Religion and HIV/AIDS, Charting the Terrain. That subtitle is very important because the purpose of that project was to show, at least in religious and theological studies, how far we had come at that point. But this book is different because it takes the conversation further. And what Jacques now and the authors have done is very successfully allow us to hear the theological and ecclesial voices that have fought against HIV/AIDS in Africa. And that is appropriate for a number of reasons. First, probably no pandemic has been studied in history as HIV/AIDS has been studied. In fact, if you read only the theology, you are just scratching the surface because the bulk and literature in the social sciences and also the hard sciences in themselves are just enormous. I don't think that there's anybody who can say that they have mastered even a quarter of the literature that is out there on HIV/AIDS. But this is where I'm going to with this point. The fact is that the majority of the literature actually very often ignores theological voices and ethical voices. And I think in the context of Africa, that's a huge mistake for a number of reasons. But I think one that is quite obvious is that even though I characterize the attitude of the church in Africa as one that is bipolar, in that We have been very critical, very judgmental, very often of people who are living with HIV/AIDS. But it is also the case, as you will find in this book, that the African churches have been at the forefront in fighting the pandemic. We can use a number of illustrations, but I think very quickly they have deployed almost all of the church health care services, the Christian Health Association of Africa, which is an ecumenical group, almost all of the Catholic hospitals in Africa, at least those of us in the Baptist, almost all of our Baptist hospitals in Cameroon particularly, have devoted a lot of energy and resources in working to curb the spread of the pandemic. So, on the worst days, you go to an academic conference and you sit quietly and you listen to social scientists very often dismiss the work that is being done by scholars of theology, and then you say, oh yeah, that's what academics is about. You listen to a critique, and then on your bad day you are screaming inside of you and say, damn it, these people are not educated. If they are educated, they should know that at one point we used to be the queen of the sciences, and we're no longer the queen, but I think my point you get is that theology has been brought to bear on understanding this disease. And like Jacques now says, the picture that is painted in this book is not all rosy, because I think we have opened ourselves up to critique and examine what our societies are. It's a book that will be alive for a very long time because of the diverse things that have been discussed in this book. Next, I think there are several divisions. The first one deals with the social dimensions, and in that section, this is a random pick. We did not discuss who I should highlight, but it's a very random pick of myself. But Lado Ludovic actually challenges us to think in a much more broad way. If you take the individualist approach, what has happened is that people have emphasized individual behavior. And those behavioral approaches to fighting HIV/AIDS, especially in the context of the church, have focused on sin, people out of step, people doing things that are not appropriate. While there's something true to the fact that at some point one has to assume individual responsibility, the danger is that it has created the broader context in which the church is not ministering to the totality of the human being, but has engaged in actions and discourses that promotes stigma. But Ludovic also argues that the social context theory, while it has broadened the discourse, which allows us to talk about African cultures, about African communities, has achieved so much, we need to look beyond that, because there is no monolithic African culture. But on the other hand, we need to follow the argument that has been placed on the table by those who argue from the context of culture, because they are actually practices, either marriage practices, customs, which has put women at a very significant risk in light of the HIV/AIDS pandemic. But then he then adds that we ought to be very careful, because what happens when people invoke the cultural logic is that in an age of biomedical sciences, people tend to ignore that there are actually cultural specific practices which may not be a hindrance. And he goes back to invoke the old logic by Evans Pritchard, arguing that Africans understand the how something happens. But sometimes when it comes to the question, why did it happen, many people back up from answering that question, meaning that in a discussion about HIV/AIDS, we need to bring to the table also not only the how, but the why, the when, and ask the broader question about structural issues that allow the pandemic to continue to spread as the way it has done. In the second section of the book, several essays, but I picked the one on gender, AIDS, and the Bible in Africa. Priscille Jomure has argued, actually doing biblical exegesis like biblical scholars do, arguing that gender is a major problem, not only because more than half of the people living with HIV/AIDS in Africa are women and young girls, but largely because there is a broad context in which both Islam, Christianity, and even indigenous religions have taught that women should be subordinate to men. And she goes through a very careful biblical exegesis of the familiar text, Ephesians chapter 5, beginning at verse 21, and to argue that even if you read it in English, forget about the Greek, forget about all the others. If you read it in English and parse the text like a text should be written, the main argument that comes at the beginning of that section, biblical scholars always call it a pericope, that is a group, a body of text that is together. At the beginning of that text, what is laid out there is that men and women, all people, be imitators of God. That's the first finite verb. The next finite verb follows that, which is be subject one to another. That is, subject yourself to each other. Now, when you take those verbs together in the biblical sense, then the argument is men and women, husband and wife, you should imitate God. Men and women, husband and wife, you should subject yourself to one another. It should not come from the other person. And then the rest of the text then is an elaboration of the different modalities, how this is to work out. I mean, if in that context it appeared that Paul might have made some, what should we say, might have actually gone too far to say women should obey, I think when you go back to look at the main commands of the text, then it becomes very clear that women are not to be dominated, women are not to be subjected in the manner in which they sometimes are done in our cultures, which has led to this. And so she argues then that when you look at that completely, it calls for an understanding of equality, an understanding of partnership, an understanding of relations within the household that will not continue to promote the vulnerability that women experience. In this third section, I have picked the essay on small Christian communities as agents of change in East Africa, written by none other than the Venerable Father Joseph Healy, who has championed narrative theology in the African context, asking that at least the kind of conversation should emerge from within the community itself. It's an impressive essay, not only because the scope to which he makes one see that, you know, there is Christianity. Then I'm almost tempted to say then there are the Baptists and other denominations like Catholic. No, there is Christianity. There's a Catholic Church worldwide, okay? The Catholic communion, there's the Anglican communion, there's the Baptist, there's Presbyterian. So, but then within the African context, a journey that began in Latin America, there are these small Christian communities which have been part of the Catholic tradition for a very long time. What has happened in the African context is that these people have gone out and started to work to show compassion, show love, touch, embrace people who are HIV positive, go home, visit them, take communion to them, cook food for them, do all kinds of things for them, accompany them to the doctor, make sure that they take their medicines. He says that has really changed radically what is happening in HIV/AIDS, and he argues that at the macro level, all the things that states need to do, all the things that denominations need to do must continue, but we cannot lose sight of this sort of one-to-one contact and enablement that comes out of this kind of a theology that takes place in small Christian communities. And then in the next section, since I was coming here, I might as well just talk about my chapter, and it doesn't mean that I think it's a wonderful chapter, but the stigma, and what I do in that chapter is discuss historically the idea of stigma. Most people know that the word itself derives from the mark which slave owners put on their slaves in ancient Greece, so that if that slave escaped, then when people saw that mark, they would be able to bring the slave back to its owner. And so hence the English word stick, because the word that was used was stick, that's that mark, hence the word stigma. Already, so the word is born out of a negative social context. And I think for a very long time, two key studies in the 20th century, one by Emil Durkheim, in which he talks about how a group of people define something as unwanted, separate themselves from it, and then criticize what has been so described as unwanted. That's the way stigma works. Even after Durkheim, I think the concept would not receive so much attention, but in the 1960s with the work of Irving Goffman, it actually enters health studies in a very big way, in which he talks about diseases, how it sets people apart, how people avoid and then look with disdain on people who have this kind of disease. And throughout the chapter, my burden was to argue that some of the actions that we took as Christians, as Christian leaders, promoted stigma. The emphasis on sin, the emphasis on prostitution, the emphasis on truck drivers, the emphasis on the way widows were treated in other parts of Africa, rather than really expose the disease, created a context in which people barricaded themselves and stigmatized the others. There are cases where people were killed when they told their families that they were HIV positive. And that has happened in several places in Africa. But I think what the review process did for the book, and I can attest to what Jackie now is saying, is that in my case, I think most of the readers say, look, state what has happened after that to bring down stigma. And of course that was easy to do because once antiretroviral drugs were introduced and people, rather than looking skinny, looked as beautiful as they were, even though you couldn't tell that the person was HIV/AIDS, it took away a lot of the stigma. We do know from what Father Healy has said, the small Christian communities, the fact that they were able to go and associate with people, it took away stigma. There are studies in Swaziland which demonstrates that once home-based health care was introduced in many places in Africa, stigma, the rate of stigma went down. I mean, we still have stigma, we still struggle with that kind of difference, but I think we need to realize that there is so much work that needs to be done in this area. In the next section of the book, I picked the one that talks about ecumenical theology. This was written by a veteran of ecumenical theology, Nyambura Njoroge from Kenya, one of the early founders of the Circle of Concerned African Women Theologians. And she argues that in the African context, once Jonathan Mann had talked about the place of the church in fighting the pandemic, which would then later on lead UNAIDS, the World Health Organization, to actually formally invite religious communities to do something about HIV/AIDS. The World Council of Churches formed a committee that would, the Ecumenical Initiative for HIV/AIDS. And that group has been headed by several Africans, Musa Dube from the University of Botswana, Sue Perry from Zimbabwe, and then I think the current coordinator, Ezra Chitando from the University of Zimbabwe. They have worked so hard and published enormously to educate churches to be AIDS competent, to understand. And they have done so regardless of denomination or church community. And she argues that that initiative by the World Council of Churches was the beginning of a very serious theological engagement with HIV and AIDS. The second, of course, is the group network of religious leaders living with and personally affected by HIV and AIDS in Arela. This was formed by Canon Gideon Biemungisha from Uganda, who came out as a clergy person and said, I am HIV positive. The blowback, the criticism, the abuse, the insults, and so forth. And then when he began to talk to people, he realized that there were many clergy people who were living with HIV/AIDS, and they have done enormous work to be able to teach and speak as clergy people who are HIV positive. And then the third group, of course, in the African context is the Circle of Concerned African Women Theologians, who decided in the late 80s that they are going to push all of their categories, all of their resources in fighting HIV and AIDS. They have done several books, some of them published by Jesuit publishing houses in Nairobi, some of them by Cluster, which is the joint publishing house that was started in Pietermaritzburg and Scottsville in South Africa. And what they have done is done empirical studies as well as do critical theological reflection, which have actually helped us see broadly what HIV/AIDS is. And then, of course, the criticism from the women's perspective is on negative aspects of the culture, which has placed an undue burden on women. And this is, they're not saying African culture is bad. They are simply saying they are practices that have been hijacked, misappropriated, and directed in an area which has privileged men and made women victims. In fact, in one of the books, they tell a telling story which happened in Nairobi, but which could be replicated all over the continent, where there is an elite family, so they have house help, and the house help that is working, just to show you the deeds of women in which the circle, members of the circle have exposed. One example. So this young maid, the older boys of the household actually take advantage of her sexually. But it doesn't stop there. The father of the house also takes advantage of the maid. So the only person who has no clue is the wife. And of course, when the wife finds out that she is HIV positive, what would happen? She, summarily dismisses her, drives her away from her house, not knowing that what has happened has actually come out of her own household. And then there are many stories which the circle has uncovered. Women are the caregivers. Usually when the man falls ill, they do everything, they feed, they take care, they do everything. And then once he dies, or even before he dies, relatives begin to point accusing fingers at her that she infected their son, she infected their brother. And like they argue in the text many times as women, the only thing they have done wrong is that they got married. Okay, they got married. And so when Jack now says this is an angry book, this is the kind of thing that you find in the text. And then I have just really two more, and I will be very brief. The next section, I picked an essay by Evelyn Namakula Mayanji. The argument is very straightforward. AIDS, national security, and political leadership. She argues that even though we do not want to say AIDS is the only big thing, we want to write in such a way that future generations are able to see AIDS as a very tragic moment. But we also want to highlight that at a time when it is occurring, AIDS is probably, in the African context, every nation, the greatest national security issue that all of those countries have faced. Nobody talks about it like that. And the reason why it is the greatest national security issue is because it affects a large portion of the budget of every state. I mean, the only problem is that both faith-based organizations and African governments have actually depended on donors. In many countries, there's actually really little or no program for HIV/AIDS except what comes through from NGOs, faith-based organizations, and international organizations like the Bill and Melinda Gates Foundation, the Global Fund for HIV/AIDS and Malaria, and then the William Jefferson Clinton Foundation on HIV/AIDS. Then, of course, I think the mother of them all is, ironically, actually the President's initiative on HIV/AIDS and malaria, which was started by President George Bush and continued under President Barack Obama. And so the question then is, if it is decimating populations as it is, and we know not only from the work of Paul Farmer, but many social scientists who have worked on Africa, that poverty, structural violence, inter-ethnic struggles, so many wars that have been fought within the continent have contributed significantly to the escalation of HIV/AIDS. Why is it that many African governments, following the United Nations Security Council declaration, I think it's of 2001, not declared HIV/AIDS a national security issue? Or number two, why have they not also, following the African Union decision, I think it would be of the same year, or 2005, I need to check my dates here, not committed 15% of their budget to fight HIV/AIDS or to the health sector of their economies? Why is it that many of the multinational corporations working in Africa, take at random oil, for instance, there are global companies all over the coastline of West Africa, down into South Africa, into Mozambique. Oil is discovered in Kenya, so one expects that there will be production very soon. Why are all of those companies not seeing HIV/AIDS as a major, major threat? I mean, we have lost a huge generation of people. Millions and millions of people have perished, and millions continue to. I think currently estimated about 35 million people in Africa living with HIV/AIDS. You would have to multiply many wars, many wars, to be able to come close to the kind of national security that HIV/AIDS is a threat of. And our purpose in this book is to be able to lay it on the table and ask ourselves the question, what have we done? What have we done as Africans? I mean, I think we can talk eloquently about global economic inequities, but we can also ask the question, what have we done with resources when several African countries are major oil producing countries? Why is it that when every politician at a certain level in Africa gets a cold, they are flown overseas and treated? When that cold could be treated in Cameroon, that person didn't have to leave Cameroon. That cold could be treated there. But by the time the bill that comes from treating that one individual comes home, it is money that could have renovated 10, 15, modernized several healthcare centers on the continent. And so this is the kind of thing that he raises in that chapter and argues that there is a need for good governance, there is a need to recognize the security threat HIV/AIDS is, and then come up with bold programs for the future. I mean, she actually outlines several steps reminding the Church of its role following Gaudium et Spes from Vatican II to actually continue to speak out. Finally, the essay on home-based care. I have already referred to this, so I don't need to go over this essay. I think there's a lot that can be done. What do we want you to do? We want you to ask us questions, but maybe I need to do what I'm asking you to do that I haven't done. Maybe create a Twitter account and then put this book on. It is good for everybody to read this. It is good for all churches to have this book in their library. If you know an NGO or a faith-based organization that you have any influence on them, it is good to tell them to get a copy or get as many copies. It's easy to think if you are going to Africa on a mission, and that is what I see. Every time I'm on a plane going to Africa, I see people with T-shirts that made T-shirts. They're going to Malawi, they're going to some places and so forth. You might also want to suggest that if they can invest $300, $400, $500 of that budget and buy copies of this book and make it available to denominations, make it available to libraries, church libraries, that we will be planting a seed. And on Facebook, everywhere, talk to your friends about it. The staff of Orbis is not immediately going to go and live in or go on some fancy holiday somewhere because we bought this book. Believe me, publishers don't make money, but I think the idea is that we need to spread the word and spread the word as widely as possible. Thank you so much. I think I've taken more time than I was supposed to do, but it's a pleasure to be here and visit your beautiful campus. Thank you.
Let's open it up for question and answer and some discussion here.
I have a friend in New York who grew up in Nashville, in the Southern Baptist community, and he said in the 80s, in the gay community when people were dying all the time, he was present for these incidents where the stigma around AIDS was so severe in that community that the parents wouldn't be in the hospital room with the dying son. And he said something, we were just talking about this the other day, he said something interesting. He said now he sees the antiretroviral drugs are so good in the United States that he said he's worried that the disappearance of the stigma makes certain people in high-risk communities treat it as a chronic disease, not as a fatal disease. And obviously once that happens, then you're at risk of infecting a lot of other people. And I was curious, as either of you see that as a byproduct of, is the same thing happening in communities where there are now better access to drugs in African communities?
You want to go first? Yeah, no, we see it. We see it a lot. I know 2 or 3 people who have died from HIV complications, and that is because they went to the Baptist hospital in Cameroon, that hospital is participating in the antiretroviral drugs. So there's an initial intake, and then once you do that initial intake, then all of the medication is actually free. And so they feel wonderful, they look great, they can play soccer, they can walk, they can do everything, and so on and so forth. And they drink a lot, they tend to turn to drinking, and then they go on and have relationships without care, say, I'm fine, I'm okay. And then they infect more people. And I know at least 3 people who have died because of that. And I think the answer to that in the long term, and this is our concern here in the book, is that churches should not lose their guard. We don't want to go back to a point where stigma was so bad, but we want to be able to say, look, there is no all clear here. What can we do? But above all, I think the essays that talk on structural violence are quite clear on the need for the kind of public policy, because whether the states of Africa like it or not, they have the major responsibility to set out policies that will that everybody working on health issues will do that, and curbing stigma and promoting medication is still a better way. But yes, you're right. It's a very dangerous situation because many people say, "Oh no, I'm okay, I'm fine. That whole thing was a lie, or it was a misdiagnosis, it was a mistake," and then boom, 5-6 months after, they die.
I live in the city of Beira in Mozambique. I work in Mozambique for a few months, less than a year. And I realized that with the first line drugs, Sant'Egidio was able to reach a level of success of more than 92%. You know, people are well followed up, and they have the very basic treatment. You know, we have the first line, the second line, the third line. The third line is when, like the level of resistance is really high, and they move to the very high level. And if somebody is still resistant with the third line, is over. So this is a death sentence, okay? So, it requires a lot of discipline to avoid alcohol, you know, to live positively, the psychological dimension, and many other things. But when somebody begins to take antiretroviral treatment, he feels well, you know, life just goes on as it used to be, and sometimes people will even get out of the treatment, you know, and just live a normal life, you know, have sex, do whatever you used to do, and pass on the virus to other people. And this is one of the drawbacks. And one of the major concerns that we even have now is that children born with HIV/AIDS are now teenagers. Some are even, you know, young adults. What do we do with that? You know, I met a friend of mine. One of her nephew was born HIV/AIDS positive. He's completing high school. And the question of identity, sexual identity, is a major issue with this boy, which is normal. It's part of his part of the human development process, you know, and she's struggling to, you know, to pass on to this kid, you know, you were born HIV/AIDS positive, you cannot live like other teenagers of your age, this is what you should be doing. So many other complications that we have to deal with, you know. But for us, you know, as people who are any connection with the church or with an association, is that we need to continue the fight. The fight against AIDS is not over, you know. So just like Professor Baumba say, we have to continue. Yeah.
Well, thank you both for being here, for putting this work together. I was wondering, you were talking about the ecumenical work and theology, and just thinking about the realities of some countries in Africa in terms of conflicts that are, you know, it's Christians, Muslims. So what are the interreligious? What does that look like? I mean, so you gave a little bit of a picture of what's going on among different Christian churches. Is there a parallel to efforts like this that go beyond lines of Christianity? So in the forefront?
Oh yeah, that's a difficult question. That's something I haven't studied in depth, but I can say this. Studies demonstrate that in the northern part of the continent, that the rate of prevalence is significantly lower, and the broad generalizations are that because Muslim communities have very strict sexual cultures, it sort of slows down the rate of infection. And I think there's some truth to that. But what they have done in their communities, I have not studied that, but I do know that I have talked to scholars of Islam who have expressed a lot of interest. I think, unfortunately, the ecumenical nature of the work that ought to go on in Africa is not as strong as it should be, because I think if the rate of prevalence in northern Islamic countries is lower, I think in addition to just really strict rules, we ought to be finding out what else is going on, what lessons can be learned. And but in terms of the other way around, what can Muslim communities learn from Christian communities about developing a free individual who can go anywhere, do anything, and then what both communities then can then find out, how do we keep our people and our population safe. So there's still, I think, a lot of work to be done on the ecumenical front. The only other thing that I know that is working very well within the African context that I have studied two organizations, both based in Nairobi, the African Christian Health Network, which has been in practice for a very long time. This is a consortium of African Christian hospitals who then also partner together, work with overseas donors in order to coordinate the work they do, especially on HIV/AIDS. The other one is the Ecumenical Pharmaceutical Network, which was actually also championed by the World Council of Churches, but supported by a German Christian mission. The Ecumenical Pharmaceutical Network is based in Nairobi. What they do is they order drugs and then sell them to member Christian hospitals across the continent. In fact, they have made so much progress that they now have their own pharmacies and labs that they can actually test the drugs. They were telling us a very funny but sad story 3 years ago at a conference in Addis Ababa. They ordered a batch of malaria drugs. Then when they tested the first box and the second box and the third box, they all didn't have the chemical compounds that are supposed to make that pass as malaria drugs. So they said when they called the company that shipped the drugs to them, they could hear a gasp at the other end of the phone say, "Those boxes were not meant for you." And so their question was, they were meant for who? So my answer has gone far afield, but I think we still need to do a lot more work on ecumenical the ecumenical fight against HIV/AIDS. These are the only examples I know of things that are going on. I think the Muslims probably have been more active in South Africa than in other parts of Africa. I probably would also guess in Senegal, they probably have been more articulate in working against HIV, the spread of HIV/AIDS. In Cameroon, I'm not actually well aware. I haven't. One would have to go back and look at studies from northern Cameroon to see what is happening. Yeah.
And, I was working in Nairobi some years ago at Agent African Jesuit AIDS Network, and somebody from the UNICEF came. I mean, we have a charge, and at the end he said, "Well, you guys, you have a major challenge in this continent. The rate of infection among the Muslim population is quite low compared to the rest of, I mean, like the population in the whole continent." And I say, "Why?" He said, "Well, you study and find out. It's like a mystery. Is it due to the strong moral rules that they have? Is it due to how people are raised? You don't know. I mean, even in Chad, it's amazing. I worked in Chad for 7 years, and I work for the National AIDS Council in Chad. And one of the things that we discover is that in the south, in some part of the southern part of Chad, the rate of infection could reach like 25% among the adult population. But in the north, sometimes 1, 2, 3. Why? I mean, we don't have the reason. Some study was made, but we don't have, was quite challenging, not easy. There's something that needs to be done. And also, going the same direction, I realize that Christian churches have done a lot. Way too much. Way too much. We have done a lot as a church, whether Baptist churches, Catholic church, or Presbyterian church, or whatever. But what seems to be a major challenge to me, and probably should be a challenge to the churches, the Christian churches, and I was talking with Professor Kanyandogo, maybe we need to write a paper on that. How do we gather all our experience as churches and find a way of building a stronger coalition based on the experience that we have had on HIV/AIDS to move the issue of public health forward in the continent? Because in some countries, the churches run more than 60% of the health facility.
Yeah.
So why are we absent in the area of policy making, health policy making? And if we are present in the area of health policy making, we should be present in the area of social policy, because there's a direct causality between good social policy and good health policy. So that's one of the major challenges we're thinking of. Is there something we can do as people who have worked in that field to push the issue forward? Which is not always, the major concerns of the leadership of the church, like bishop, pastors or moderators of conferences, of conventions, of churches. So there's something that needs to be done, and there's a piece which is missing. And this is the major part of what we can offer, is about learning from experience, learning from practices that we have developed while facing HIV/AIDS, to suggest something which can be lasting and can impact the life of people, not only in the healthcare sector, but in other sectors,
Yeah.
All the social determinants of health, which are outside, the healthcare sector. So that's one of the, just to follow the same.
Yeah, it is. Well, it is greatly complicated because one does not understand why a very small denomination like my denomination, the Baptist, has taken so much burden on HIV/AIDS, and yet they are not usually part of government policy. When you talk to people who do all of these meetings in Africa, the politicians have gotten very smart. They have memorized all of the language that is used by UNAIDS, the World Bank, the World Health Organization, all the big funders. And so even when they call a meeting, it is not to critically examine the local context and allow issues flow. They simply read declarations from all of these places. We have to do this, we have to do this, we have to do this, we have to do this. And then it is done. Then they qualify for some loan, or they qualify for money from the Global Fund and so forth. And in many cases, that money has been mismanaged. And the churches are very toothless. There is really nothing they can do. When you have somebody like Christian Cardinal Toomey fight the regime, then it becomes a one-man struggle. In the case of Cameroon, he's a bad priest, he's against the president, he hates the regime, and so on and so forth. So something needs to happen. Maybe, like Katangole says in creative ways, maybe liberation theology is really dead. Something needs to happen big that allows the churches to rise up and say, look, we don't want to destroy our communities. We see our people every day at our clinics, at our hospitals, at this, and we must have a voice. Sure, there is a voice. There's a voice at the UNAIDS, there is a voice at the World Health Organization, but that is a very limited voice. The place where the real voice needs to be felt is within African countries themselves, so that they can shape policy. I still think, and I think a lot of the contributors in the book argue that if African states, even with the few resources we have, make this the emergency it is, HIV/AIDS, the Ebola virus disease, all of the help we get from the international communities would go very, very far.
So we're probably out of time. If anyone wants to stay and chat, they may be available for a few more minutes. But I just want to thank them both again for bringing to our attention such an important issue.
Thank you so much. Yeah, thank you.
Thank you for coming.
Thank you.
Thank you.
Thank you for taking time.